Most people have never heard of metabolic syndrome, yet millions are already living with it, quietly, without knowing it. Metabolic syndrome is not a single disease. It is a dangerous combination of conditions that slowly damage the body. You may feel mostly fine. You may look healthy on the outside, but inside, serious damage may already be happening. Metabolic syndrome is the stage before major disease. Before diabetes, before heart attacks, before strokes. Doctors often treat the results, rarely the root cause. So what exactly is metabolic syndrome? It is a cluster of metabolic problems happening together. These include high insulin levels, elevated blood pressure, abnormal cholesterol, increased belly fat, and rising blood sugar. One problem feeds the next. Each condition worsens the others. At the center of metabolic syndrome is insulin resistance. Insulin is the hormone that controls blood sugar. It also controls fat storage. When insulin stays high all day, your cells stop responding. This is insulin resistance. Sugar stays in the blood. Fat storage increases. Energy production drops. Your pancreas works harder. Your liver stores excess fat. Your blood vessels become inflamed. This process can take years, often without obvious symptoms. Blood tests may look borderline. Doctors may say, just watch it. But damage continues silently. Abdominal fat is a major warning sign. This fat is metabolically active. It releases inflammatory chemicals. These chemicals raise blood pressure. They disrupt cholesterol balance. They worsen insulin resistance. Over time, the risk multiplies. Heart disease risk rises sharply. Stroke risk increases. The brain is affected as well. Inflammation reduces blood flow. Cognitive function slowly declines. Many people develop constant fatigue, brain fog, poor focus, low motivation. This is not aging. This is metabolic dysfunction. Diet alone is not just about calories. It is about hormonal response. Constant snacking keeps insulin elevated. Sugary foods worsen resistance. Highly processed carbohydrates overload the system. Stress plays a major role. Chronic stress raises cortisol. Cortisol raises blood sugar. Poor sleep makes insulin resistance worse. Lack of movement slows glucose usage. Metabolic syndrome develops from lifestyle patterns, not from a single bad choice. The good news is this: metabolic syndrome is reversible in early stages. Insulin sensitivity can improve. Inflammation can decrease. Organs can recover. This requires addressing the cause, not just lowering numbers on paper. Fewer eating windows, better food quality, reduced stress, restorative sleep, regular movement. Medication may still be necessary, always under medical guidance. Reversal does not mean ignoring doctors. It means understanding the process. Metabolic syndrome is a warning system, a signal from the body. Ignoring it leads to chronic disease. Addressing it restores balance. Most people are diagnosed too late. You don't have to be one of them. Understanding your metabolism changes everything. Awareness is the first step. Prevention is powerful. Early action is life. Your body is adaptable. It responds to the right signals. And metabolic health is the foundation of long-term survival. Let's understand why metabolic syndrome is so often missed. Because it doesn't arrive with pain. It doesn't come with sudden illness. It develops slowly, quietly, in the background of daily life. You still go to work. You still eat regular meals. You still function. But your metabolism is under constant strain. Blood pressure begins to creep upward. Cholesterol balance shifts silently. Waist size increases gradually. None of this feels urgent at first. That's why it's dangerous. Metabolic syndrome is a long-term stress response, a mismatch between modern habits and human biology. The human body was not designed for constant eating, or continuous sugar exposure, or chronic psychological stress. Yet modern life delivers all three. Breakfast spikes insulin. Snacks keep it elevated. Lunch raises it again. Evening snacks prevent recovery. Insulin never gets a chance to fall. High insulin signals the body to store fat, not burn it. Over time, cells defend themselves. They stop responding properly. This resistance forces the pancreas to work harder. More insulin is released. The cycle accelerates. Eventually, the system begins to fail. The liver becomes overloaded. Fat accumulates inside liver cells. This worsens blood sugar control. Blood vessels lose flexibility. Inflammation damages their lining. Blood pressure rises further. Cholesterol particles become more harmful. Plaque formation increases. The heart works harder with less efficiency. The brain receives inconsistent blood flow. This explains memory issues, slow thinking, reduced concentration. Many people describe feeling off, but can't explain why. Standard tests may still appear acceptable. That creates false reassurance. But metabolic damage is cumulative. It compounds year after year. Eventually, blood sugar crosses a threshold. A diagnosis is finally made. Type 2 diabetes, hypertension, cardiovascular disease. But the problem started long before the label. Treatment often focuses on numbers. Lower the sugar, lower the pressure, lower the cholesterol. These steps manage risk, but don't always restore balance. Real improvement begins with metabolic awareness. Understanding how the body responds to signals. Food is a signal. Stress is a signal. Sleep is a signal. Movement is a signal. Change the signals, and the body changes its response. Insulin sensitivity can return. Inflammation can decrease. Blood pressure may stabilize naturally. Energy levels can improve. This process takes time. It requires consistency. There is no overnight fix, no miracle solution. But the human body is resilient. Given the right conditions, it heals. Metabolic syndrome is not a failure. It is feedback, a warning before irreversible damage. Ignoring it leads to chronic disease. Understanding it creates opportunity. Education changes outcomes. Awareness saves lives. This is why metabolic health matters. This is why early action is critical. Most people are never taught this. Now you are. Your health trajectory is not fixed. It responds to informed choices. Metabolic syndrome is reversible early, preventable always. Knowledge is the first step, and action is what changes everything.